Hello everyone, I am Dr. Ghanee. I am an oral pathologist. In my YouTube videos, I show you precancerous and cancerous conditions that can happen in the oral cavity. Also, ulcerative conditions that are autoimmune or they are reaction to something that we're eating or reaction to toothpaste or mouth rinse or any kind of oral hygiene product. Sometimes we never know why we develop an open sore on the side of the tongue or inner cheek. I believe all these open sores, they come due to some kind of irritation, local irritation. Sometimes there could be a sharp tooth or a broken filling that can cause this. A lot of open sores that they're long lasting and they don't heal, they can be oral cancer. But a lot of them, they are not oral cancer, but they don't heal because lots of bacteria and fungal elements, they get into it, they nest there, and that's why the ulcer does not heal. Plus, oral cavity is getting all the acidic food, all the spicy food. So when mucosa is trying to heal, sometimes what we eat does not let that healing process happen. Usually when I see a patient with open sore like this and there are clean borders around it, usually my experience, this is not oral cancer. This is an ulcer that does not want to heal because bacteria and fungal elements, they have nested there, as I said. Let me show you other examples. This one also, it's a deep ulcer, open sore, but it has clean borders. I have done biopsies on these two, and the pathology result was non-specific ulcer with candida. Candida means fungal infection. It means that fungus that is in the mouth has nested there. Over the years, this is my experience. When I see an ulcer with clean borders, I always put the patient on antifungal rinse to eliminate all the fungal elements. I give patient antibiotics to take, and after 2 weeks, the size of this ulcer diminishes. It becomes much smaller, and then I remove it to promote healing because sometimes they do not want to heal. Some of these ulcers, after a long time, gradually they make callus tissue all around them. This callus tissue is called hyperkeratosis, though this is an ulcer and this is hyperkeratosis around it. I have removed these two ulcers, and again, the result was non-specific ulcer with fungal elements in it. So basically, when we have an open sore that doesn't heal, we have to be super careful and we have to get it checked with our provider because it can be cancer. But my point from this video is some of these that have clean borders, even with callus formation around, these are not cancerous. They do not want to heal because of fungal elements and bacteria. But it is easy to manage these. As I said, we try antifungal and antibiotics. When they shrink, then they become smaller. I remove it completely and we promote healing. Basically, we refresh that area and we monitor the patient until it heals. When we remove an open sore, we actually create another ulcer. So we have to be careful. We have to monitor the patient, which I usually recheck in 2 weeks and then 2 weeks after until I see complete healing. We do not want to get oral cancer, and we want to be super careful about any ulcer or open sore, especially on high-risk areas, side of the tongue, under the tongue, and floor of the mouth. Thank you for watching. Have a good day.